Hello, I'm Dr. James Meschia with the American Neurological Association, and I'm here today with Dr. Lorenzano, who will be discussing her poster that will be on display at the meeting this year.
Hello, my name is Svetlana Lorenzano. I'm a neurologist. I was trained in Italy, the University La Sapienza of Rome, and currently I'm a stroke fellow at the Department of Neurology at Massachusetts General Hospital.
So I was wondering, before we get into the details of your work, if you could discuss for me the clinical dilemma that you're trying to approach with your research.
Yes, we know that stroke is a huge problem for the healthcare system. More than 700,000 people in the US are affected by stroke, and some of these patients can benefit from some reperfusion therapy that could be also based on the presence of mismatch, on the presence of ischemic penumbra. And so we know that advanced neuroimaging technique may provide fundamental data on brain tissue fate, but on the other side, criteria for diffusion-perfusion mismatch are not widely standardized and validated and are not available across all the centers. So we try to understand if we could find some biomarkers that can timely and identify patients with subjective brain tissue.
And what would you consider the most innovative aspect of your work?
First of all, this is one of the largest studies on biomarkers in hyperacute ischemic stroke, and this is a study that was funded by SPAC's program from NIH and NINDS, and I would like to mention Professor Karen Fury, who is the PI of this study. And the most important innovation is that, to my knowledge, this is the first study that tried to evaluate whether biomarkers, and particularly oxidative stress biomarkers, can have a role in studying the brain tissue fate, and also it's the first time that we tried to assess whether these biomarkers can predict mismatch in acute ischemic stroke patients.
And how did you approach the question of research? What methods did you use?
Yeah, we in almost 3 years and a half, we prospectively measured plasma levels of biomarkers in acute ischemic stroke patients presenting within 9 hours of symptom onset in 2 large academic centers here in Boston, at Massachusetts General Hospital and Brigham Women's Hospital. And we measured some biomarkers like oxidative stress biomarkers like F2 isopercent, which is a marker of oxidative stress-induced peroxidation of membrane phospholipids and lipoprotein. And also we measured ORAC, which is an oxygen radical absorbance capacity. That is a functional assay that measured the total plasma antioxidant capacity. And we measure other biomarkers, but these are those we try to study in this analysis. And moreover, we include in these studies 216 patients, and 71% of these patients has a mismatch more than 20%, so which we define like a clinically significant mismatch. And we found that compared to those with MRI evidence of no or less than 1%, 20% mismatch, patients with larger mismatch had higher levels of F2 isoprostane and ORAC. And these results were confirmed also after adjustment for other confounding variables like age and age stroke scales, or infarct volume, or onset imaging to blood draw times. What I found interesting is that we found not only that F2 isopercent, which is a marker of oxidative stress, is increasing in these patients, but also the ORAC, that is the measurement of the antioxidant capacity of the plasma. So it's like a sort of compensatory mechanism to the increase of F2 isoprostane. And moreover, patients with higher ORAC had a higher chance to have a higher percentage of mismatch salvage.
And what would your expectations be about the future of this line of investigation?
So, short-term expectation would be that to include these biomarkers in trials to show if these could be also markers of responsiveness to certain therapies. And in long terms, probably this could be also a target for novel therapeutic strategies in acute ischemic stroke.
Very good. Well, thank you for your time.
Thank you.